Good afternoon, everyone. I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council. Got a great group of people here. Thank you all for being here. It's the end of funnel week, so we have a lot to cover here. Just a couple of housekeeping things real quick. Try to stay on mute if you're not talking. We should have an interpreter. Jeff is with us today, pinned, so hopefully you can see him. There's also a closed captioning option down the bottom if you hit more. We have a lot to cover. There may not be time for questions, but we'll try to get some of them when you put them in the chat to get answered as we go. Also, just want to put a plug out when you do sign off today. We do have some poll questions, just a couple that we'd like you to fill out. That really helps us gauge what information we're sharing, what's helpful for you, and what more you'd like to hear. So if you have just a couple more seconds, please do that. Poll questions. And with that, I'll turn it over to Amy.
Hi, everyone. Oh, hello, everyone. We can go to the next slide here. I'm going to just go through very quickly, since we only have a half an hour, some of the bills that made it through the funnel deadline. So just quickly, to remind people that may not be aware of what the funnel is, hopefully the screen's going to come up here. Are you guys seeing anything on the screen?
No.
Okay. Here's my chutes and ladders. I think I did this when my kids were little. But this is the process with the legislative process. And as you can see, this is where we're at, where that little "You Are Here" button is. We have gotten to the first deadline, which means bills have to be out of committee. They're originating committee, so that first committee they're assigned to, they have to be voted out in order to stay alive. So what you're going to see this next week is a lot of floor debate trying to move the bills from one chamber over to the second chamber. So like out of the House and over to the Senate. So they can get it out of committee and the other chamber by that next deadline, which is a month away on March 20th. So if you want to go to the next slide, I'm going to go over quickly some of the bills that survived this deadline. But again, I put in the chat, you can move to the next slide. I put into the chat the link to the bill tracker, which will have all of the updated information available. Heidi, can you go to the next slide, please?
Yes, I think I'm on the next slide here.
There we go. Okay, so the bills that are still alive, these are some of the ones, a late breaking one I just wanted to make a note of. This is Representative Wilson introduced, oops, we went past it. Representative Wilson introduced this bill this week and then got it out of committee already. So she held a subcommittee and a committee. Right now, driver's licenses are able to have a marking that tells a police officer or somebody looking at it that the person has autism spectrum disorder, and this just changes that. So it's a non-apparent disability marking, so it would be inclusive of any intellectual disability or developmental disability or serious mental illness. So that kind of just broadens it. Again, we talked about earlier the regular rate reviews for home and community-based services providers, the accessible prescription label for individuals who are blind or low vision, adding vocational rehabilitation programs as work search activities. So if somebody is on unemployment, that this would count toward work, or if you have work requirements for SNAP. And then also allowing driverless cars in Iowa, which is something that people with disabilities have been talking about as an option to get around in their communities. We can go to the next slide. There's a few that I wanted to highlight on the education side. There were a lot of education bills, but oops. Sorry, I don't have mine up, so I'm reading it off the screen too.
Sorry, we're having some technical difficulties just getting the share switched over here.
Okay, so on the education side, there were a few I wanted to bring up. Many parents have been looking at an option to do video recordings in special education classrooms. That did make it through. It's a little controversial. Some parents think it will end or stop or reduce bullying. Others feel it's a privacy violation, and as it's written right now, it doesn't comply with federal privacy laws, so it will have to be changed a bit if it moves forward. Um, we had talked earlier about Representative Ingles's tuition grant program being used for comprehensive transition post-secondary programs. And then the couple other ones, the one for separate schools for special education students and those with behavioral health needs. And then a resolution that just basically asks Congress to eliminate the U.S. Department of Education. It doesn't, resolutions don't change law. So I wanted to spend most of our time, I'm going to turn it over to Carlin on the next slide, which we're going to talk about public assistance reforms and the expansion of the MAPD program. These are what we really wanted to spend most of our time talking about today. So I'm going to turn it over to Carlin to take the lead on this one.
Hello, everyone. I'm Carlin Crow with the Iowa DD Council. And yeah, you can pull the slides back up. We're going to focus a little bit here on our two bills that contain language similar to the Work Without Worry bills with Bill, which we have talked a lot about in the past and this year too. This year, these bills that the language is included in they're not called Work Without Worry, but we can still call them Work Without Worry because everybody else is, just because it's not printed on the bill. So want to talk about that a little bit later when we talk about messaging. But there's two bills in particular that are for MEPD changes to eligibility in the MEPD program. And that's for Medicaid for employed people with disabilities. The House version is a study bill 696, and that number is going to change because it did pass subcommittee and the Health and Human Services Committee. And so it stayed alive and will probably move quickly. It is part of the MEPD changes are, let me first say, they're not exactly what we wanted. It's, in fact, a very watered down version of the previous Work Without Worry bill and the provisions that we really wanted, which were the elimination of income and resource or asset limits for people on MEPD so that they could earn and save to their full potential. So what this bill does is raise the income limit to 300% of federal poverty level. It's currently at 250%, and that means about a $7,000 difference for someone who is earning wages and in that category, which is not bad, but it's a very small step in the right direction. And the main problem is it does not change the resource limits at all. So that, as we think, and what the original bill writer intended, is the main problem. People aren't able to save to buy a car, maybe even, maybe buy a house. Bigger, and it doesn't have to be big life changes. It's just a barrier to not be able to save the money that you are earning because it could kick you off of your Medicaid. So House Study Bill 696 includes that language, but it also includes language about changes to SNAP, the WIC program, eligibility for other public assistance programs having to do with immigration status. That includes Medicaid also. So there's some good things about it, and there's some very concerning things about it. And for us, the language about MEPD is acceptable. It's not great. So, we're kind of caught in a how do we how do we advocate for this bill, even though it's, a step in the right direction, but also it could include some changes that hurt people in the disability community. So between that and the Senate file 2315, which is the one on the bottom there, it's the same language, but in a Senate file that is only contains the MEPD language. So it's a standalone bill, as we would call it. And we want to thank Senator Dennis Guth for bringing this forward. And as we understand it, it's because of advocates in his area and his constituents who advocated to him extensively to get it written into a bill and moved into a subcommittee. So we were thrilled that this came out of committee yesterday, even though it was not on the original agenda, which would have meant that it would not have survived the funnel, but it did. And it did because advocates, again, advocated it to move forward, both with Senator Guth and with Senator Kara Warmy, who's the chair of the Health and Human Services Committee. So it passed out of the Senate Health and Human Services Committee yesterday unanimously and very enthusiastically by several members of the committee. And even our advocate, Zach Meekum, who has been speaking extensively on these bills and how they could help people with disabilities like him, he got a shout out during the committee meeting for educating lawmakers on how and why these bills are important. So it was a great win yesterday. Small step in the right direction, but a great win, and hopefully also gives all of you and all of us some energy to move forward past the funnel. So what we're what we're talking about with these bills is that they're great. They're a step in the right direction, but we still have to worry a little bit. It's not work without worry yet, because we still have to worry because there's still limitations and still isn't getting everybody quite to where we think big change could be made for a larger group of people if some of these other asset and income limits could be adjusted. One part of both bills that I'll mention that has gotten some attention and people really like about it regarding MEPD is that HHS will have to set up an electronic payment system. So people don't have to write a check anymore to pay their MEPD premium if they have one. And we've heard from advocates that this is a big deal. And so that's another step in the right direction and a small change that could make a big difference. I will point out that the Senate Study Bill 3140 is another public assistance reform bill. And Amy put together a really great comparison of those two bills that I think, did anybody put it in the chat? Sorry, I haven't been paying attention. But it's a very helpful comparison that looks at all of the divisions and provisions in both of those bills and all the things that it would change. So I encourage you to go and look there for all the changes, because we really don't have time to talk about all of it today because there's so much. One of the concerning provisions in 3140 is what's being called a codification of managed care, which means that they're putting into code that Iowa has to administer their Medicaid programs through managed care unless it's fee-for-service. And right now there are 5 or 6 programs under fee-for-service. One of them is HIP, and it was concerning to see that there's language in there that says, the way that we're interpreting it is that programs that are now fee-for-service will continue so long as they're in place in July of this year, when that part of the bill would go into effect. So they'll continue as is, but no new programs under fee-for-service could be established, and managed care would have to stay as it is now also. So while it's kind of business as usual, it's a little concerning that doesn't allow for a lot of adjustments or changes when things might change in the future, or things might be needed to be changed in how Medicaid is administered in the state. Um, Amy, anything that I'm missing or you want to chime in here?
Yeah, I was just going to say, kind of along the lines of that locking in of managed care. Both bills, both the House Study Bill 696 and Senate Study Bill 3140, have what they call cost neutrality language in it. What that basically means is the only time that they can make changes to the Medicaid program and any of the Medicaid products, so health and wellness plan or children's health insurance, any of them, it has to be cost neutral, meaning it won't cost any more money. It could save money, but it can't cost any more money. Um, that includes, by the way, the home project waiver that we're in the process of reviewing. So that the public comment on that was due last week. And so that's one that would fall under this if this were in place. The only way you could go about making a change if it was going to cost even $1 more would be to have the legislature approve it. And I can't remember which one. I think it's the Senate version has language in that includes that state plan amendments, which are really easy fixes. You don't need you don't have to go through the whole federal process to get a waiver. It's a much simpler process. So you couldn't even make a state plan amendment to make a change without legislative approval. So it really just makes this be a status quo Medicaid um, budget and plan, no changes. So that's really concerning. That would include future changes to the MAPD program, which would cost money. And even though it saves money, or could save money, it's probably not going to meet that cost neutrality. So even if this doesn't get passed this year and this bill does, if MEPD changes don't get passed this year and this bill passes, you would have to go through legislative approval every time you want to make a change to increase the eligibility income or anything else. So that's really concerning. I think a lot of legislators think it's because those in power right now are concerned about if they lose power, they don't want another party to come in and make changes. So they're locking things in. Um, Yes, Kevin. So Kevin Harris is on. He and his wife and daughter came to the Capitol this week and actually testified in the subcommittee about the program, the HIP program, and some concerns about the language that's in there now as well. So we've had great success with people coming to the Capitol, and there have been advocates up there every day working on one aspect of lettuce work or another. It's been great.
And along with that too, I'll plug that right after this Capital chat, we're doing it's called a mini training, but it's a discussion too about what's going on. And if you're coming to the Capitol, what kind of things you can talk about. And, you know, you can ask simple questions like which door do I go in and things like that. So I'll put the link to that in the chat. It's a separate link from this one. And please join in with, any questions you have or even stuff that we talked about today, and we'll try and get through it all. One more thing about these bills is that we know that the MEPD language will have amendments, and so they have to clarify some things, and also they're again concerned about cost. So watch for more on those.
Kay, the Senate study, it's that first one there, Senate Study Bill 3140 is the one that has the managed care lock-in language. Mickey asked to talk about more about the HIP concerns. Carlin, can you do that? Or I don't know if Kevin wants to talk about that. Don't want to put him on the spot since he's just here listening.
Well, I can, yeah, and Kevin, you can chime in, but we just clarified a minute ago that the HIP language or the fee-for-service language, as we understand it, says that what the fee-for-service programs that are in place now or will be in place in July of this year when the bill goes into effect will stay in place. So that means the HIP program, which is one of those fee-for-service programs, would stay in place, but no new programs could be added, or changes that are, or the programs that are in place cannot be changed easily because they're in status quo. So that's how we understand it right now. It's the language is a little wonky. Kevin went to the subcommittee, and I missed it. He was there to fill in and did a much better job. So Kevin, if there's anything you want to share on that you may have heard from the committee, please chime in.
Just folks were just appreciative of it and had some follow up with a couple of the individuals. So after excuse me, after the meeting, and I think it was just a good opportunity to educate that they're I think they're laser set on reducing costs, but some of these programs actually reduce costs, like HIP. Examples I gave were the amount that the state spends on the HIP program and in my particular case, saves hundreds of thousands of dollars because we have private insurance that picks up the bulk of my daughter's care. So, and then just realizing what these programs really do, and it's not that it's not really not a negative detriment to the state. It's actually a huge positive because it's saving a significant amount of money.
Thanks, Kevin. And I know too, there's a lot of chat going on in the chat about some of the education bills. There are some bills that, as Amy pointed out earlier, made it through the funnel. We know some of them, again, are going to have amendments, but we're considering having a kind of listening session on that, or get some feedback from advocates about what you all think of things and what direction you would like to see these things go. So stay tuned for that. I know there's so much we could talk about today. We could be here all afternoon, right, Amy? But Amy has reports to do.
Well, and I will just say none of the positive things that we have noted here today, even if there's some they're thrown in with some negative things, all of the things that are positive have happened because advocates have been working hard. And I'm going to say, I mean, really working hard. I know at least 3 who have come to the Capitol at least 4 times this year already, and have really been putting pressure. And honestly, I think when you read my report this weekend, I talked about where there's a will, there's a way. It is true. Legislators have a lot of tricks up their sleeves that they can use to get a bill reintroduced or to bring the issue back up. So, it's just like Senator Guth had put in a request for a bill and just never filed it until he found out that there was no other option to get the MEPD program moving forward in the Senate. So he filed it one day, had the subcommittee the next day, and managed to get it added to the agenda at the last minute at the last committee meeting before the funnel. So all of that happened not because Carlin and I were at the Capitol. It happened because of the advocates who kept the pressure on and kept sticking to their message and saying, we want to be able to work. What I thought was the best example was a woman named Erica. She didn't say her last name, but she is I think she said C5 quadriplegic and is a CPA, works for an educational organization, and she made too much money, fell off the Medicaid program, and now pays $35,000 a year just to help her get to work for the services that her insurance won't cover. So she said the example is you have one person sitting at a desk right next to the other. One person, they're both doing the same job. They're both making the same money. One of them pays $35,000 out of pocket to just get to work. I thought that was the best example of how stark the difference is in that.
Any other questions or things that we can clarify? Again, we'll pick up on some of this if you want to join at 12:30 on the next call.
And we are going through these on our report this weekend, so it's done. So hopefully you'll be getting it either today or by Monday. Get that report. So it'll have all of that. Our bill tracker has all of the bills. It defaults when you go to the bill tracker, it goes right to only those bills that survive the funnel. So what you see there is going to be the ones that survived but and are still alive. But if you want to see what didn't make it, there's a little drop down. It says active. You just click the active button and it changes to inactive, and then hit search bills, and it'll show up on the bill tracker. So you can see the things. You can go back and forth between what made it and what didn't. And if you happen to have an organization that you're on a board of, or you can always download those into a spreadsheet. The bills, it'll always have the most current status. So that automatically updates when things are changed at the Capitol. But I do encourage you to watch social media, watch our Facebook, either the DD Council or Infonet. And because when these bills come up for debate, we will make sure we post that, and where you can watch that live. You can watch it live just going to the legislative website at any time. They'll be debating a lot this next week. So trying to get bills out of the House and over to the Senate, and out of the Senate and over to the House. So
Amy, do you want to, Kay had a question in there about explaining the difference between study bills and other bills. Do you want to take just a second to talk about that?
yeah, I forgot. I was going to mention House Study Bill 696 and Senate Study Bill 3140 are going to get new numbers. Study bills are just requested by the committee chair. So once they're out of committee, they get a House file or Senate file number. The only real difference between them is the study bills are sponsored by the committee. Um, a House file or Senate file can be sponsored by either the committee or an individual legislator. So when these bills will get new numbers, and we'll let you know. But even if you go to click on these links to the bill, it will, once it gets a new number, tell you what that new number is. You still have to click on it, but I don't know I was just trying to see what that long post was. Anyway, that's the primary difference between the two. All right, we got 2 minutes left. Other opportunity? Yes. Patricia asked if you could add to these bills. All bills can be amended on the floor. So you can ask if you don't like something, like say Senate File 2315, you want to see, some advocates had suggested moving it to 300, and then a year later 350, and then a year later 400, just so that there's a little phased in approach so you can tell if it costs too much. It kind of addresses that, it's not going to end up blowing the budget. Um, you can ask your legislator or any legislator to amend it, and they can do that. So anybody can amend a bill, including one that didn't make it. You can amend it onto another bill. Misty asked about the ticket to work. Yeah, HHS, Misty, I think is so HHS had said in the committee that if we made changes to MEPD program, we'd have to switch to ticket to work, which would cost more money and raise the age. I think Carlin's got some clarification on that, and I don't think HHS had it exactly right. Is that correct, Carlin?
All right. Looking at the chat, what did you, what was the
Oh,
question?
it was just that she asked about the ticket to work change. So
Oh, yeah, that's where we'll be looking for amendments, probably because of there's some clarification that needs to be made about that. So we
yeah.
still don't have all the information yet, and neither do the legislators.
Yep. Well, I know we're out of time. Here, we'll go to the last slides. Again, just the reminder, the mini chat or the mini training afterwards for those that want to, I mean, you can continue to talk. It's kind of just a drop in extra half hour that Carlin's hosting to make sure that if people have more questions or if they are wanting some help and getting ready to go to the Capitol or talking to your legislators by email. Carlin and I are working on some advocacy alerts that we can use our Take Action Center to help you out with that. So stay tuned on that as well. All right. Well, thanks everybody. Carlin's gonna switch over.
Thanks, everybody.
Bye.